Well, the number of total joint replacement surgeries continues to rise. In fact, it is estimated that by 2030, 67 million Americans will experience some form of osteoarthritis. Joining us is orthopedic surgeon and director of total joint replacement at the Bone and Joint Institute, Dr. Robert Carangelo. Well, just in the past 5 months, surgeons like yourself at the Bone and Joint Institute have performed over 1,200 surgeries. Who is the ideal candidate?
The ideal candidate, Dina, is someone who has end-stage osteoarthritis of either the hip or the knee. And that's when the cartilage has become so deteriorated that it now is difficult for them to walk or enjoy certain qualities of life that you and I would tend to enjoy. So as the arthritis progresses, they become more painful, more stiff, they have difficulty walking. And that's the ideal candidate is initially, the ideal candidate fails conservative management as well.
So when we talk about someone with osteoarthritis, what are the symptoms that they experience?
The symptoms are usually pain. That always brings them to our office, and then it's associated with stiffness, and then a reduction in their level of activity that we often take for granted every day.
Yeah, absolutely. And the future's bright for patients with osteoarthritis. Robotics, nerve blocks, what does it look like?
Yeah, the robotics have been around for 10 years, but it's becoming much more sophisticated and refined in its development. So it's making it easier for us as orthopedic surgeons to put an artificial joint in. The bioengineers are doing a wonderful job in putting substrates on the implants to increase ingrowth, and which improves longevity, and also reduces the risk of infection. And finally, the pain management that is associated with total joints is becoming very sophisticated.
Thank you so much, Dr. Carangelo. For more information, you can log on to boneandjointinstitute.org. I'm Hartford Healthcare's Tina Verona.